This is a really good example of when you see someone who just primarily breathes with their upper chest and also in their neck. You can see all of the neck muscles very clearly. The person on the left is talking and the person on the right isn't. So when you see someone speak, it's going to be very common to see a lot of the neck muscles. When this person is not speaking, you're not necessarily supposed to see all the muscles. If you do, it just means that that is telling you how the person is breathing. If you see yourself as either of these people, then you can say, okay, well, I'm going to work on my breathing. And in this case, this is upper chest and neck breathing. This means that this person is probably not using their belly breath. Try different methods for breathing because the one that works for you is going to be the best one. This is a really interesting picture because this is actually a good representation of a lot of clients that I've had over the years. All the people that wear high heels are always going to have tension in the back of their legs. They're always going to have issues in their lower back, and they're always going to have issues in their neck. You know how she's going to breathe. But what's really interesting is she's adapted to wearing high heels. I think the most important thing that you can see in this picture is that the woman has complete control over the individual body parts that she's using. You can tell that she has appropriate breath control because of the way in which she is using her body. It's very stable, it's very mobile, but it's being used together very appropriately. Training is about adaptation, not demonstration. The ladder drill that you see on the left is designed to make more agile runners, quicker feet, faster feet, that sort of thing. But it doesn't translate into better athlete or better performance on the field. It just means faster feet. There are other things that you can do besides a ladder drill that will make you a better soccer player if you want, but having fast feet isn't necessarily the best way to go about it. If you took the sled away and put a lawnmower in front of them, I think it would make sense why you're doing that drill. You don't have to have a lawnmower or have to push a lawnmower to be able to use a sled, but there are reasons why you should be able to push. One could be pushing your kids in a stroller, pushing a cart in a store. Whatever the case is, just have a purpose. I want you to disregard the fact that it says 1 through 12 months. Don't worry about if your kid is at 7 months and they're not crawling. It's not about that. The average Olympian takes between 12 and 15 months to actually walk. But I want you to understand that skipping crawling is one of the most detrimental steps you can let your kids skip. So if your kid didn't know how to crawl, the way that you can retrain that is to take their favorite toys and put them under something where they have to get to the ground and figure out how to crawl to get to that object. Each of these three movements are full body movements. They're totally dependent on every joint in the body. If the person who's squatting is just trying to get better at the squat, there's nothing wrong with that. The reason why you lunge is because you like to do things like walk. The reason why you do a push up is because you like to be able to push stuff out of your way. When you test a squat, it's going to look different than when you actually do a squat exercise. When you test a lunge, you're testing the independence of the upper versus lower body. When you do a push up for real, you're not doing it the way that you see in the testing position. Do you suppose it's going to be a real easy thing to do, like run and kick a soccer ball, if one of the legs doesn't work like the other leg? If you're a right footed kicker, you're going to have some variations versus being a left footed kicker. The legs basically have to work the same, or you're more prone to injury. This is a client that came to me with a lot of left hip pain. She couldn't lean forward, she couldn't really do anything. She couldn't really be in any position without it hurting constantly. Between me and the chiropractor, we got her to a place where she could finally squat. And it's kind of important. You just want to be able to get stuff off the ground, remember? She can't go very low. This was the first time I captured her squat, and there's a lot of pain right now in her face. She's not holding on to anything. She has a wall behind her, and that's as low as she got before she fell backwards into the wall. And this is 10 seconds after this one. She's now holding onto a railing, and no, her hip doesn't go below her knees, and it's not even parallel to her knees. She got to 80 degrees right there. So, with a little support, I wanted to show her how low she could actually go. Her new goal mentally is I want to be able to get to some place around here when I'm actually doing it with no support. The magical way that you don't lose something like a squat is that you don't stop doing it. They'll find a way to move around. They'll find a way to make that Lego set into something they can play with. Again, it's just their imagination. But they don't play on even surfaces in most cases. They don't play anything but games. Adults, we sit in chairs for long periods of time. We sit in cars. We get our food delivered constantly. When we do exercise, it's on maybe something like a treadmill or a machine where it can only move in one particular way. There are some people where they see something on TV and they go try to do it and they get hurt and they don't understand why. If you're starting your movement journey, or if you're even in the middle or an advanced user, sometimes it's okay to just take a step back and let somebody look at how you're doing it to make sure that what you're doing is going to be productive. Make sure that you consider the source of the information that you're gathering. And is that information helpful for you? Is that information going to keep you out of trouble? Or is that information going to give you good options to avoid trouble? In movement programming, some people are going to look at something and say, wow, look at that athlete. They're doing that. That's going to be great for me too because that athlete did it. Well, if the athlete who's paid to be a spokesperson for a specific product can do the activity effortlessly, that doesn't mean that you're going to be able to do it effortlessly, especially if you can't move like that athlete. So consider how the information is being presented to you, whether or not it's going to be helpful for you or not. Doesn't mean it's going to be useless in your entire life. It just could be that right now it's not the right thing for you. I know that if I want to get in trouble, I can look at any Curious George adventure and get into trouble. If I want to get out of trouble, I'm going to have to read through that information and find out what the man in the yellow hat did to get George out of trouble. So there's a little bit of information that you need to source through and you need to look and you need to make sure that, okay, this is what's helpful, this is what is not helpful. So it can take a minute. Please be careful out there. The short answer is no. If you sustain a concussion or if you have a stroke, you can lose the ability to use your body for either short periods of time or altogether. All of these five things, stability, coordination, synergy, balance, and timing, these are all what you normally associate as muscle memory. The way in which you stabilize or coordinate your body. This is a program that you wrote based on how you did it in the beginning. You created this ability to move from somewhere, and it was feedback from the ground. Babies learn how to stand, and they wobble, and eventually they learn how to stabilize. Your program that you move with, it's stored in your brain. It's something that you access every single time that you make a movement. If you twist your ankle, or if you break a bone, or you do something that creates pain, that program can change. A client came to me with severe back pain. He threw his back out. He knew what he did to do it, and in a lot of cases that's not true. People don't always know how they created this situation for pain. He was startled in the middle of the night, and like an alarm was going off or the sirens were going off, and he had to get out of his bed to get out of the house. He couldn't get out of the sheets. They got tangled in his legs, and he kicked so hard that he threw his back out. Well, that's a pretty weird random situation, but it happened and now he has pain. Now he's walking different. So if you create pain, you're going to create a higher risk for injury. You're going to change the way that you move because your body doesn't want to be in pain when it moves, so it's going to avoid that pain at all costs. So if your knee hurts more than your hip, then your knee is going to be the thing that you try to avoid putting in pain and not your hip. You can have multiple compensations happening at the same time, but the one that you're going to be aware of is the one that bothers you the most or that inconveniences you the most.